Thank you, Madam Speaker and members. Today, the decision about how we provide health care for sick and poor Minnesotans rests in our hands. A week ago, we passed a proposal off the floor with strong bipartisan support. The bill costs less than auto enrollment. It covers more Minnesotans and institutes reforms that will provide better care for the sick currently served in general assistance medical care. There's a handout on your desk that lays this out for us. Our proposal that we passed costs $281 million, but gains $30 million in federal funds. So the total state cost is $252 million. The administration's proposal of auto enrollment costs $254 million, earning no federal funds. Our proposal costs $457 per person per month. Auto enrollment costs $937 per person per month. Our proposal maintains the solvency of the Healthcare Access Fund. The auto enrollment proposal requires significant cuts to the Healthcare Access Fund, jeopardizing the health care coverage for working Minnesotans. The governor accepted these numbers. He said in our first meeting that he did not dispute these numbers. We worked over the course of the weekend to find a compromise with the administration. After 7 sessions, conceptual discussions, and offers that we made to move closer to the governor's position, including stronger reforms where there was a lot of common ground, an increase to the rates paid to providers, and offering to make our proposal permanent, repealing GAMC in current statute. After making these concessions, the administration returned to the refrain that this issue should be solved in the context of the budget and that they prefer to auto-enroll this population into Minnesota Care. They prefer the more expensive option, offering less coverage to sick Minnesotans. According to DHS testimony in December to a joint Health and Human Services Policy and Finance Committee, auto-enrollment of general assistance Medicare enrollees into Minnesota Care will yield a high rate of uninsurance and uncompensated care. Here's that math. Roughly 30,000 Minnesotans are enrolled in GAMC each month. Only 20,000 of those Minnesotans will be auto-enrolled into Minnesota Care. Only 5,000 of those Minnesotans will retain Minnesota Care post-auto-enrollment. Only 3,300 of those Minnesotans will retain Minnesota Care past the first renewal, and only 1,300 of those will retain Minnesota Care past the second renewal. Auto-enrollment will cost Minnesota taxpayers more for less coverage, but we were unable to convince the governor's staff of that over the course of the weekend. The auto-enrollment process is beginning now, unless we stop it today. And this was a major point of discussion over the course of the weekend. From the start of our work after the veto, we have been told that the process of auto-enrollment will begin on a firm date, and that date is February 28th. This is our last chance to put a more cost-effective proposal into place. That's why we're here today. I know I'm asking a lot of you. I know an override vote is a tough vote, but this is our last opportunity to stop the implementation of a more expensive policy. Today we are fighting for the vulnerable. Today we are fighting for what we believe. Today is policy before politics, and it is a test of our courage to lead as policymakers. I ask for your vote. Thank you.